about chronic suppurative otitis media. Okay, as it is a chronic disease, it will associated with long-standing infection in the middle ear. Okay, and characterized by air discharge and permanent perforation in the tympanic membrane. So firstly we have to know about the perforation of the tympanic membrane. So we have to know about the perforation of the tympanic membrane. Okay, so there will be two type of perforation: the central perforation and the marginal perforation. As we divide a tympanic membrane into four quadrants, so depend on that there will be small type, then medium type, large and subtotal type. Okay, so in medial type only one quadrant will be involved. In medium type, two quadrants will be involved, and large type, three quadrants will be involved, and in subtotal, whole tympanic membrane, whole the four quadrants will be involved in the subtotal type. Okay, and in marginal perforation, along with the subtotal type, that is the whole four quadrants will involved, and along with that, the fibrous annulus will be eroded in the marginal type. Okay, so around the tympanic membrane the fibrous annulus is present, that will also be eroded in the marginal perforation. Okay, severe type. So now back to our main topic. Okay, so we will be dividing Csom in two types, that is mucosal type and the squamosal type. Okay, the mucosal type is also known as safe type and tubotympanic type. Okay, and the squamosal one is also known as unsafe type or dangerous type and aticoantral type of Csom. Okay, now let's talk about the mucosal type in detail. The mucosal type is characterized by, or you may say it, a definition of the mucosal type is permanent central perforation of the pars tensa for more than 3 months. Okay, so firstly we have to note that this is a central perforation of the tympanic membrane, and the which part? Pars tensa, and the main key point is more than 3 months. Okay, so that is the characteristic. And how do you know that is a permanent perforation? Okay, so mainly the tympanic membrane will get hit itself by or within 3 months. So the disease is more than 3 months, so it will be clue for a permanent perforation. Okay, so in mucosal type perforation will be central and in the pars tensa, and for the more than 3 months, and following with acute suppurative otitis media and trauma. So it is a continuation of the acute suppurative otitis media, and it is maybe due to trauma. Okay, as we said early that it is also called as tubotympanic Csom because the infection is from eustachian tube lead to infection of middle ear. Okay, and then in mucosal type there is no evidence of invasion of squamous epithelium in the middle ear. It is a very important thing. So it is doesn't associated with cholesteatoma. So there it is the key point. Okay, it does not associated with cholesteatoma. So the mucosal type may be active or inactive, as it is with discharging here or without discharging. Okay, if there is a complaint or history of discharge here, then it will be active type, and is no discharging, that it will be inactive type. So active type, there is a perforation, okay, permanent perforation. Okay, and it will be associated with inflammation of mucosa of the middle ear. The whole mucosa of the middle ear will be inflamed. Okay, and it will be discharging. The discharge will be mucopurulent. Okay, and if we see the inactive type, the permanent perforation of the pars tensa will be there, but there is no inflammation in the mucosa of the middle ear, and there is no discharge. Okay, so how the patient will give you a history of mucosal type of Csom? The patient is always associated with some degree of conductive hearing loss, and the and it will be not exceeding 50 decibel. Okay, it is up to 50 decibel of hearing loss. The hearing loss will be conductive type, and the secondly, the air discharge will be mucoid type. Okay, there is it is a characteristic. The mucopurulent discharge will be there in the ear. Assessment will be the examination under microscope firstly. Okay, the second will be audiogram. We'll be doing audiogram. The third one is we'll be doing sensitivity for ear disease, and fourthly we'll be doing mastoid X-ray, CT scan of temporal bone. Okay, so as we confirm the case, it is a mucosal type of the CSOM, so we need to treat that patient. So our aim will be control the infection first. Secondly, eliminate the ear discharge. Okay, eliminate the ear discharge. And the third one is we'll be doing it later on. It is correct the hearing loss. Okay, patient will be some degree of conductive hearing loss, so we need to correct that hearing loss. Okay, so firstly we will giving the oral toilet, the removal all discharge plus debris. Okay, then we'll be giving the air drops, the antibiotic air drops containing niacinamide, polymyxin, chloromycin, okay, gentamicin. All these are used as a air drops. Okay, then we giving the antibiotics and instruct the patient to keep ear dry during the bathing, swimming, all of that. Okay, and lastly we have to do the surgical procedure to correct the hearing loss, that is maybe a tympanoplasty and myringoplasty. Okay, the correction will be correct the tympanic membrane and we will correct the ossicle. So we will learn about squamosal type of CSOM in next video. I hope the video is helping you for better understanding of your topics. Stay safe and take care.